And so at any point, so you were infected from you said 96 to around
95
to around
yeah,
2006,
seven
around the time.
2007, yeah.
Okay. Did you ever develop those symptoms of AIDS?
No, I didn't.
Okay.
I did have I had a CD4 count below 300, which at the time I came back to the United States, basically, if you had a CD4 count below 300, you were considered to be an AIDS patient. And even if you were in better health than before. So when I came back here, I was cured of HIV, but technically I was an AIDS patient.
I see. Okay.
Kind of weird, but yeah.
And
Go ahead.
so that doctor that started the treatment, that was purely experimental treatment at the time.
Yes, yeah. He actually was a hematologist and had absolutely nothing to do with HIV before my case. Yeah, and so for that reason, people didn't really want to believe that a hematologist, that's basically somebody finishing their studies. He wasn't really even completely finished with his studies.
Also, he was still very young. Okay.
Yeah. And they didn't want to believe that he could cure HIV.
Okay. But how did he know about this? Or how did he think about this? I mean, he must come up with the idea that there might be a theoretical chance that it might happen. So how did he come up with that?
He paid attention in his classes and had heard about that mutation. It's basically a good mutation, which basically makes people immune to HIV, and
does not have any negative symptoms.
Right. He hypothesized with no real clear understanding if it would work or not. He hypothesized that if somebody with HIV were given, if their immune system was replaced by one that basically was immune to HIV, that they would in fact be immune to HIV, and so he tried it and it worked.
Okay. And so has this ever been repeated?
Yeah, well, successfully no, but in December 2010, right before I moved to the United States, back to the United States, I had dinner with Garo, and he said that they had tried it with 8 different patients, and they had all passed away from their original illnesses other than HIV.
Okay.
So, yeah.
So it's not something that you could use as a general cure because the process of doing the stem cell therapy is highly risky in itself.
Yeah. And in itself, it's basically about 50%.
Oh, wow. Okay, so it's really it's
yeah.
Okay.
Yeah.
And at that point, were you aware of that, or did you not have any other chance because the cancer was so progressed?
Yeah, I didn't have any other choice. Yeah, basically, it was an experiment that had to be done.
Okay. Would you have done it if you did have the chance?
When I was
sorry, you're half out of the screen. If you could just move a little bit. Oh, yeah, sorry, it's better. Yeah, perfect.
Oh, so when I moved my hand. So when I was thinking about whether I should do it or not, and my leukemia was in remission, I thought, basically, I'm doing fine with HIV medication, and I can keep taking these and do fine with them, and by that time I was already at the point where basically people with HIV were living as long as other people that didn't have it, and so for that reason, I decided I didn't want to do it unless leukemia came back. And so yeah, I was recently asked if I would do it if I had to do it all over again. If I were in a situation where I wouldn't live or not, or wouldn't live if I didn't do it, I'd do it. Otherwise, probably not.
Okay, because the risks are so high, and the HIV is quite manageable at this point.
Right. Yeah. And for that reason, it's very difficult to find people willing to participate in studies, because basically people that participate in studies are doing it purely for altruistic reasons. They're not really doing it for themselves, because there is no guarantee that they will have any clear benefit from it. And so it's very difficult to find people to say yes to doing the treatments that might kill them.
I see. So, as you're an activist now, and you fight for awareness of HIV. How do you see the situation now compared to 20 years ago? You said it's become manageable. It's become easier. You can live as long as you, any person who is not infected. So, yes. How has the situation changed?
The situation has changed in that because it's manageable, because basically you can be HIV positive and hide it. Nobody has to know unless you decide to reveal it. You just have to take your medication, and as long as you take your medication, you'll be fine. There isn't as much activism toward finding a cure or a vaccine for HIV. That's in the developed world. That's in the United States and Europe and other places that are highly developed. Unfortunately, the situation in Africa, for example, has improved, but not completely. People are still dying of AIDS in those countries, in the developing world, and for that reason, I think a cure is necessary.
Okay, and so it has to become less of a problem where you have the access to the funds to manage it well, but in those countries who don't have that access, it's still a big problem. Yeah. And okay. And
and Eastern Europe is a mess as well.
Oh yeah.
Now.
Okay.
For example, I talked to this woman on Facebook for a long time, and she, over a period of about a year, and she's HIV positive, and she was getting care, but really bad care. People, like doctors would get more money if they agreed to treat people with HIV. There's still a huge amount of stigma, and she said that they get old drugs, like drugs that are even rejected or not used in Europe and the United States, because they're not good.
So that first generation AIDS medication or HIV medication. Yeah. Okay.
Exactly. And that's in Russia. I mean, you'd think that Russia would be one of the better ones because it's got more money than other places. I mean, it's probably because it's so highly tiered in the wealth, because and people that have money there usually don't freely give their money out to poor people.
I see. So, because my feeling was that when I look at the generation after me, so the kids of my friends and the younger generation, they don't seem to care as much anymore. I mean, my age, we used to be scared of HIV and protect ourselves in any way possible. As long as it was reasonable. But nowadays, the kids don't seem to care anymore. It seems like they're like, yeah, it's nothing will happen. And is that a problem? Do you see that?
Yes, it is. For example, the rates of new infections are very high, and I think up to the ages of 27, they're very high. And actually, because of Viagra and other things that you can take for rectal dysfunction, they're actually high in people over 65, believe it or not.
Oh, okay. So they're becoming active now, and then
right, yeah. I had an opportunity to speak in several high schools in the area around Palm Springs, California, in the county where it is, and I don't think that apart from us coming into the school, I don't think they even talked about HIV at all.
Not even at school. Not even. It wasn't part of the agenda.
Right,
wow.
Right.
Okay.
Yeah.
Oh, that's not good.
It's sad. And I also heard that non-gay couples, they would have anal sex because it doesn't count.
Yeah, you can't get pregnant.
Right. Yeah, you can't get pregnant. Right.
Well,
yeah.
Forever.
Yeah, and anal sex is definitely the most dangerous form of sex you can have in terms of risk of infection.
Okay. Is that because there are more injuries to?
Yeah, it's because the skin of the anal passages is only one layer of skin, whereas the rest of your skin, you have 3 layers of skin.
Okay.
You only have the dermis or something like that. I don't know.
So it makes it easier for the virus to pass through. Basically.
Right. Yeah. Exactly. And then there's more chance of bleeding from friction, things like that. Yeah.
And now combine it with the fact that pre-cum has a higher virus loads, and then even if you pull out, it doesn't help really much.
Yeah, exactly. People think that pre-cum isn't dangerous. Yeah,
doesn't count as well.
Yeah, it doesn't count.
Anal doesn't count, so we're good.
Yeah, exactly.
Okay.
Exactly. Right. Yeah, and I think that there's this idea that if you get HIV, it's no big deal. Because you can take medication, and so you have to take a pill every day. So when I started, I had to take many, over 20 pills a day. Now it's down. Some regimens are only 1 pill a day.
Okay, so
they're combinations of 3 different medications in 1 pill.
So it's almost like taking a vitamin a day, and then you're good.
Right. Yeah, exactly. Yeah. Last year I was invited to be a part of this conference in Seattle, and the person that invited me asked me to participate in a seminar on HIV cure, and so I said yes, and he started, basically this was the whole thing. He asked people what they thought of HIV cure, and for themselves or for other people. And I think about 70% of the people in that room, and these are HIV activists and people that have HIV and should know a lot about HIV and probably do. I felt that about 70% of people said they did not want a cure.
They did not want to cure for themselves?
Yeah,
Or in general?
Or in general, yeah.
Why is that?
Basically, because they okay, for one thing, their identity was based on being HIV positive, and they, because, well, in countries like the United States, Switzerland, Europe, they get benefits. They, a lot of people don't have to work because they are HIV positive, and so they fear. Oh, some people's housing are based on the fact that they have HIV. They get dental care, medical care.
So they're afraid if they get cured, they lose all the benefits.
Right. Exactly. Yeah. Yeah.
Okay, so that's,
and benefits are not as good in the United States as in Europe, obviously.
yeah.
So, I mean, this I'd say most of the people that were in the room were from the United States.
Mm-hmm.
I think I'm on this group, this Facebook group called International Group for People with HIV and Those Who Love Them.
Mm-hmm.
And I always got the idea that the people in that group, in that Facebook group, wanted HIV cure to happen. Mm-hmm. They wanted to be cured themselves, and they wanted other people to be cured. I have to get water. So, sorry, I had to get a new bottle. Let me open it.
Yeah, so it's basically about the monetary benefits that you get from
exactly, yeah.
I understand.
So, yeah, I think the fact that people are saying that they don't want an HIV cure will lessen the pressure on the government to fund cure.
Okay, so
research and
less activism, less government funding, less
exactly,
awareness.
Exactly.
Okay.
Yeah, and I think that's sad because it's something that needs to happen.
Yeah. So what are the things that you are talking about and fighting for? I mean, besides the obvious, your story is of course, I guess, one thing, but what's important for you in terms of awareness? What's important for you in terms of your speeches that you give? And
my speeches, okay, if I've been kind of evaluating this in my head, whether my speeches are different from speaking to scientists, people at universities, and patients or people with HIV. I think for people with HIV, I give them hope. Mm-hmm. And for the scientists, I give them a reason to keep going with their research.
Okay.
Yeah. So, and I'm not really sure if my speech differs. I used to give my speeches. Well, I used to actually read my speeches written by other people.
Okay.
I don't do that anymore. I'm going in the bedroom because people are talking out there. Yeah. So yeah, I quit doing that and basically just give my speeches. I mean, I know my story, so yeah, I don't need to prepare things for anymore.
Definitely, yeah, I understand.
Right. Yeah. So did I answer your question?
No, yeah, you did. So it's about, it's about the awareness, not forgetting about that. It's still a disease that might be more curable, but it's still a very severe disease and a very risky one, and we shouldn't neglect it just because it's manageable.
Yeah,
I understand.
Exactly.
Okay.
Exactly.
You said you have a partner now. is he
Yes.
positive or negative, if I may ask?
Positive.
He's positive.
Positive.
Okay.
Yeah. Nearly 30 years.
Okay.
Yeah, and he is on medication and undetectable.
Okay.
So because he's undetectable, he cannot infect anyone else. Yeah.
I see.
So,
okay.
Yeah.
So it's still managed, I guess. Okay.
Right.
If you think back, I mean, you went through several severe crises in your life. I mean, you had the infection, you had leukemia not once but twice. What helped you mentally to get through that?
I think that my will to live has always been very strong. I have never been suicidal, and even if things get really bad, I never want to die. Yeah, and like I said, the love from other people kept me alive, and it still does.
Yeah. Okay.
Here comes the sunshine and burns away clouds like they never were.